Don't use the internet and social to diagnose yourself. If you go to a doctor and they're not willing to listen, or God forbid, they just want to put you on a medication, which kind of gets back to our mistrust issue, just know that there are doctors out there who will sit and listen to you, listen to your problem. A doctor who gives you a medication right away might seem like a good doctor, but the best doctor, in my opinion, is somebody who takes the time and then still says, hey, listen, let's try something conservative. Be very aware, be wary of the doctor who sees you for 5 minutes and writes you for Ozempic.
Hey everybody, welcome back to Mike and the Doc. I'm Mike.
And I'm the Doc.
I got another sticky one for you guys today. Overdiagnosing and self-diagnosing in teens. Sent you guys some literature and some videos on that. And what were your first thoughts on the topic?
Doc?
On previous shows, if they haven't watched, like I've gotten a DEXA scan, I've looked at my LDL, I've looked at all these things, right? And I'm looking to the future, right? So for me, for example, if I look at my cholesterol, well, untreated, when I'm, 70, 80, this will result in a plaque, which could result in a heart attack. And so when I get that information, I'm like, I don't get anxiety about, it gives me anxiety that my cholesterol is so high. It's not really like that. For me, it's more like, well, I can treat it now so that I don't get it. Then my argument and my bias is I want to treat it now so that I don't have that morbidity and mortality when I'm 70, 80, 90. But then the other thing about my personal bias is I am all about longevity, right? So the one argument is you're treating too many people and you're treating too many people. But then the other side of the argument is, well, what are you going to do? Wait till you have the heart attack? You're going to wait till you have a stroke or a heart attack to start the statin and the aspirin? You see what I'm saying? So that's kind of, and I thought, well, something that was brilliant in the video was the people that get screening, right, are typically white, well-educated, well-funded people that want to take care of their health. So if you screen in a population that doesn't have a lot of problems, right, then you're going to have a lot of false negatives, or basically you want to screen in a population that has a lot of problems, right? So if you can picture that, a screening test for some disease in a population that is otherwise healthy, you're not going to get a good bang for your buck. But if you have a screening test in a population that has a lot of problems, like say somebody in a poor population that's say obese, like one population that comes to mind is like the Pima Indians. Like they're very obese. Their diets have changed since their diets were changed by, war and all this stuff. And so they're at risk. So if you did a screen, if we did a screen, I'm just going to use you, Mike. If I did a screening test on you, you're white, you're well-funded, you're well-educated. I might not find a lot on you, but if I was a Pima Indian and you did that same screening test on me, you might find a lot of disease and you could help me. Do you see what I'm saying?
So it really is categories of people.
Yeah. Like, do we screen? The best thing I thought from that video was screening on a high-risk population.
Yes. That's where you're going to find the most stuff. That makes sense. So we're kind of wasting our time screening maybe people like myself.
But that's the thing is like, I also put myself into that category, right? Like I'm getting these DEXA scans, right? Like I really shouldn't get a DEXA scan probably till I'm like 70 or 80 to look
Right.
for osteoporosis. I'm looking at it for visceral fat. Why? Because visceral fat, if you have less than a pound, confers longevity. I'm going for longevity. I don't get anxiety knowing that I have a greater than a pound of visceral fat. It's like, okay, I got it. I got to do something about it.
Right.
But their argument was, well, if you get diagnosed with pre-diabetes, well, it's going to make you anxious. And maybe it does to some people. So I think you can go both ways.
Yeah, and I'm kind of I'm like you. I put things in place, like I went and got a primary physician and get checked out every 6 months or at least once a year, because I just want to be ahead of the curve versus reactionary. I have chest pain today. I need to get help now.
Yeah.
And
you don't even want to have the chest pain.
Ever.
Yeah. Agreed. I'm the same way. But the argument is, in doing that, obviously the people that although statins are off patent now, but like people that make the statins make a lot of money, right?
I was going to say that's a lot of statin
It's a lot.
that you're dealing out there.
Or blood pressure meds, right?
Right.
So high blood pressure is I want to call it a slow burn. So when somebody comes to the ER and they have an elevated blood pressure, let's just say their normal is 120/80 and they're 160/90. Okay. You know what? You're in the ER. You're seeing a bunch of people with white coats. They call it white coat syndrome. Your blood pressure of 160 or 180 for that matter, for one reading, for even a month, is not going to cause a stroke or a heart attack. However, that same elevated blood pressure over years and years and years causes stroke, renal failure, heart attack. So yes, we're putting a lot of people on these medications, and there's side effects to any sort of medication, but what's the benefit? And so, it's actually really interesting. It's really interesting. Then maybe look into number needed to treat, number needed to harm. Personally, I take I take 162 milligrams of aspirin. Okay, so that's 2 babies. And I'll probably stop at 70. Now, I don't know if we talked about that. And God, how many episodes are we at now? Like 70 or?
We in the channel,
Yeah.
I think episodes wise, we're at 7 or 8.
Okay.
Videos wise, we're I think in the 70s, yeah, including the shorts.
So let's go back maybe 70.
I think you gave us your protocol, what you take every day.
Yeah, and I'm going to
remember that.
stop. I'm going to stop aspirin at 70, because then the risk of a bleed from probably your GI tract is higher than the benefit of prevention of a stroke or a heart attack. Unless between now and 70, I have a stroke or a heart attack.
Interesting. I was thinking about someone getting a colonoscopy in their 30s for prevention, and we don't have to do it until what? Is it 45, 50
45,
now?
and that just came down.
Wow.
Yeah.
Because I always want to avoid doing that at all costs. I'm not excited.
Yeah, there is.
Don't they put you under for that?
They do, and I did do an EGD colon before the age of 45, because my dad got diagnosed with cancer.
Of the colon.
GE junction, so very close.
Oh, wow.
So I got an EGD and a colon.
Okay.
Yeah, like maybe a couple of days after he got diagnosed.
I've watched my dad go through the process at least twice. It is not friendly.
When did he do it?
I don't think he's had one in, I'd say, 5 years.
Okay.
My dad is 67, but I just remember he can't eat, and he's got to drink this formula, and it just seemed miserable.
Now there's just tablets.
Oh,
So instead of the Go, it's called Go Lightly. It's in
That's
like
what
a,
he took.
a gallon thing.
uh-huh.
Now there's just tablets you can take.
Oh, very nice.
Yeah.
And they're even doing a colonoscopy to the door, right? You can order one to the house.
I don't know about.
I've seen a commercial for that.
I'm sure it exists. There's also the pill.
Okay.
You can do a pill endoscopy where it's a little camera and a pill. Have you heard of those?
No.
Oh yeah, it's called a pill endoscopy. It's like you swallow a pill, and then as it's going down, it takes pictures. It's not as good as a colonoscopy, but sometimes we do them in patients who could not survive a colonoscopy because they're too sick.
Wow. What an invention.
Yeah, very cool.
That camera technology is pretty wild. Is it just like a wide angle camera that makes its way through your body? And
It does. It takes, and it's not on the whole time. Like it takes pictures at, I think, intervals, but it's not as good as a colonoscopy. But like, for example, in somebody who's really sick, before a colonoscopy, you got to get anesthesia. And it's funny because when I got my EGD colonoscopy, they're like, we used a lot of propofol on you. And they thought it's because I did marijuana. I'm like, no, I don't do marijuana. And so later I found out that if you run, you require a high dose of propofol.
Interesting.
Yeah. So
And propofol, that was what Michael Jackson was into.
yeah, and I was
right?
never using it to sleep. But if you have a patient who's really sick and you need to give them anesthesia for a colonoscopy, you don't have to do that with a pill. So you just give them a pill and you don't got to use the propofol. These are like for really sick people in the hospital.
Amazing technology. I didn't even know that was out there.
Yeah. So
interesting. Well, that was a tangent. That was, but I think the hot topic that we want to get into is more of the teen self-diagnosing and the overdiagnosis of more of the mental health issues like ADHD, autism, being on the spectrum. We were kind of talking off camera a little bit, Mike, about teens being at that vulnerable age where they seemingly need a sense of belonging, and they kind of find it where somebody says, "Oh, if you write with your left hand, you're probably on the spectrum," and they just kind of self-diagnose. Right. Like, what's your guys' take on that? And what, I guess, how actually, Doc, as a doctor, how would you approach a teen that came in that said they saw X and X on TikTok? They think they have this condition and they want to receive treatment for it. How do you approach that?
It's really, you bring up a lot of good points. So if you have somebody who's a teenager and they're at a tumultuous time in their life and they're learning something off of social media, and this channel is on social media, right? So you should never be diagnosed through social media. And I might have a bias because I'm a medical professional, but Dr. Google it's not a thing. It's not a thing.
Yeah, anything you put in WebMD is cancer, right? No matter what.
My advice to a teenager who sees something on social media and thinks they have the diagnosis, first of all, seek a medical professional's help. It's easy for, I do have a bias because I'm a medical professional, but what we can do, and obviously I'm a human being, so I have my own bias, right? But at the very least, you are not having somebody just using broad strokes, right? Like, hey, if you write with your left hand and you don't want to speak and you have anxiety about speaking in front of 100,000 people, you may be on the spectrum, right? So I think a really good point that they brought up in one of the videos was, what is normal, right? And again, that's another thing, what is normal? That's a great question. But like, if you took 1,000 people and you asked 1,000 people to speak in front of 1,000 people or 1,000,000 people, then would they have anxiety? A lot of them would. So does that mean they have autism? I don't think so. Because it's reasonable to be anxious to talk in front of 1,000 people. Now, of those 1,000 people, if you said, well, of these 1,000 people, how many of you are afraid to go to the mall because you're afraid you're going to get Ebola, right? If you have that number of patients in that 1,000-person group, will be much smaller. It doesn't seem to us, I'm assuming everybody in here is normal. It's not reasonable to a normal and reasonable person. So my advice to a teenager is, seek a professional's advice. And the professional should talk to you and figure out and go over the nuances. Because when you're on social media, you can just say, oh, do you have this, this, and this, right? Or like when I did my thing on the stuff that I take, right? You know, I take an aspirin and a statin, right? Well, you know, if you just had a brain bleed, right, and you were in the ICU or in the hospital for that, you shouldn't take aspirin,
Right.
right? So don't follow my advice. But but in general, you can give out general advice. But before you apply, or before a teenager or somebody who's kind of influenced by influencers, before they diagnose themselves, go to a medical professional who is good and is apt at diagnosing these things, would be my advice.
Yeah, I like that. And I really like the articles, specifically the one from Harvard. You know, I see the word Harvard. I always kind of respect the article. I don't know if that's up to date these days, but I found it interesting. I'm not on TikTok, but both articles really kind of dove into TikTok, and they have 136 million users. I said, "Wow, I'm left out here." And I'm big on, I mean, call me lazy, but I just trust the doctor.
Yeah.
So if I have issues, and I know about this self-diagnosing, and we laugh about, don't go on WebMD and start looking everything up. So I know if I do that, it's just going to freak me out. So I've always been, if I have an issue, I'm going to go to the urgent care or schedule that primary physician. They just have a lot more training. This is what they do every day, and that's what I personally would do. But I can also get the young kids, right? Like when we were in high school, alcohol, right? Alcohol kind of got us closer to one another, or you know, you became part of the party. You got to meet the cool kids. So I could see someone saying, "I have anxiety," just to be funny and be part of the crowd, right? Or I would say I have ADHD would be a big thing, right? Everyone's like, "Oh, I can't focus. I have ADHD," right? You probably get a lot of laughs in class. So it's probably a funny thing to go in and say, "I have ADHD." And so I could see that. That was kind of my take home. I know it's not right to get on the internet and do Dr. Google, like you said, and must be kind of funny as a doctor to field all of this that comes through the ER or comes to see you in the hospital. Must give you some laughs.
So there's a couple of things. There's it's this kind of a slippery slope, but there's like a T-shirt that says that autism is my superpower.
Wow.
So I kind of like the T-shirt but I kind of dislike it. Autism is my superpower. What it is it's taking the stigma out of it, right? So I have autism and people have now accepted it. Whereas when we were kids, not so much. But the argument on the other side is if you're able to put on an autism is my superpower shirt and I can laugh about it and you and I can have a conversation, it kind of trivializes, or it kind of pokes fun at the people who have real autism. Like the people that have autism so bad that they couldn't feel comfortable like even talking to you, or they feel the same talking to you as they do talking to a stuffed animal. Like it's the same thing. Like, do you see what I'm saying? Like it's not reasonable. And I'm all about acceptance, right? But with acceptance and too much acceptance comes crutches, right? So for example, any of the very subjective diagnoses, right? Like, let's just say I have a subjective diagnosis. I'm about to go and run and I'm tired that day. You know, we all get tired. All of our runs are not good every day. You know, if you do jujitsu one day, it's not going to be great one day. If you lift one day, you might not lift a new PR that day. But I think by giving a crutch diagnosis, you're like, oh, well, you know what? I couldn't run today because, I have chronic fatigue syndrome. I'm just using that as an example. And so I think the other thing that they talked about is overdiagnosis is not saying that the diagnosis is wrong, right? Like, for example, if the powers that be, it's like the National Hypertension Society or something, right? They all get together and they figure out what's the number for hypertension. So technically, if hypertension today is anything over 130 or 140, and then they have the meeting, and then the next day they have the meeting and they say it's anybody over 130, then people that didn't have hypertension on one day have it on the next day if they were at the border, right? So it's not that the diagnosis is wrong, but by doing that, by making that diagnosis and by implementing treatment, i.e. Blood pressure medications, are you moving the needle? So are you decreasing all-cause mortality from treating hypertension at a lower number? So the question is, if we lower the hypertension trigger, like the top, basically, are you lowering the number that's normal or are you elevating it? And if you lower it, then you'll diagnose more people. And by diagnosing more people and putting them on medications, are you able to move the needle from hypertension related disorders downstream, like stroke, heart attack? If you are, great. If you're not great. So the example they used was with autism on the spectrum. Okay. So thank God this is not in the States, because, our show's in the States, and I don't know if we reached people in the UK or not, but in the United Kingdom, when we were kids, right, barely anybody got a special accommodation for autism, right? Contrast that to now, there are 27 or 25 different accommodations for differing levels of autism on the spectrum, okay? And what they found
Accommodations within what?
Accommodations like if you are diagnosed with autism on the spectrum, then you may be able to take extra time to take a test, right? Or have special accommodations to take a test.
So just like accommodations in overall life.
Right.
Yeah, okay.
So by doing that, they haven't churned out better statistics for people at the end of college. And another one was in Canada, again, not the States, but in Canada, they looked at people who took special accommodations, not for autism, but for ADHD. And at the time that the student had the special accommodation, it seemed like it was better for them. But overall, at the end of their education, it did not help them, right? So now what you've done is you've given a person possibly a crutch that they will not be able to lean on in the in the real world, right? Because you might not be able, not every job allows for accommodations, right? Like, for example, in medicine, you do. Like every application that I fill out, they ask you, are you addicted to drugs? Do you need special accommodations? Or do you have any mental disorder that would require accommodations? So obviously I answer no to all those, right? But it's part of every application.
All right, Doc. So kind of going back to your, or I guess, Mike, going back to your point where you said you just like to trust the medical professional in the situation and lean on them for how to go about treatment or prevention or whatever. But there's like a seemingly growing distrust of medical professionals. Like if somebody gets online and they're like, oh yeah, according to this test, I have ADHD, but you're telling me I don't have ADHD, but I do have it, obviously. Why do you think there's such a fight with patients and doctors nowadays where they would, I guess it's maybe like a distrust in Western medicine. Like they think that it's all for profit and they don't want to cure anything. So they're just like, oh, we'll keep you on, like we'll keep you sedated rather than cure you.
I'm thinking of a couple of things. I think if somebody's had an adverse reaction or that they've had a bad situation with a doctor, maybe they had a bad surgery, right? Or a doctor gave them a medication and they had a reaction, so they have a history of something happening. I could see someone being skeptical, right? Because they've had the history, or maybe their family has had some bad reaction or adverse effect to surgery. So they kind of have that within their mind. Whereas myself, I haven't had any of those. Every time I go in, I need the help. I take the advice and I get better. So I could see somebody coming in with the history of something bad maybe happening and being skeptical in that regard. And then also, I think you have people where they just want to buck the system, right? Or maybe the doctor wasn't all the way, not accurate, right? But they weren't totally confident with yes or no. So now that person wants to argue, right? So now I go to the internet, I find case studies. I want to build a case on getting what I want, right? Because I think what people want is that they want, when they go into the ER, they go see the doctor, I want this medication, right? They got it in their mind, and all of us, right, we like to win, right? We like to win arguments, right?
We're just talking about arguments.
We're talking about arguments. So people come in like a lawyer. They went and built a big case, and they're going to present it now to Dr. Ali that I need a Z-Pack, right? That's a huge, my whole life, people, I'll take a Z-Pack to fix anything. So, and I think it makes them feel good, right, when they get what they want. And I don't know how doctors kind of operate with that, but there must be a point where it's this patient's argued so much, and there is some validity about them being right. So let's just, I hate to say the word, shut them up, but give them what they want. You know, it falls in the parameters of a good call, and everybody leaves happy. That's kind of what I was thinking.
How would you approach that situation as a doctor if you had somebody that's argumentative, but you didn't think they needed the medication, but they insisted on it? Like, how do you approach that?
Let's just use Z-Pack. That's a good one. So you have a patient who comes to the ER, and they have, it's clear as day, they have a viral syndrome, right? So,
Right.
they have myalgias, they have a runny nose, and they've had fever, but no like purulent drainage, right? Like nothing like, basically your mucus or your snot doesn't turn a different color. They have a viral syndrome, right? Clear discharge. And they are convinced that they have bronchitis, and every time they've had it, they've gone on Z-Pack. And what's interesting is if they get Z-Pack, part of it, there's two things. There's so many things in play, actually. Part of it is that the placebo effect, right? So you get the Z-Pack, and you think that this is everything, and you actually make that reaction happen to your body. It's actually really awesome. I love placebo effect. I think I said that in the last episode. There's also the fact that if we just let the viral syndrome run its course, you would get better in 5 to 7 days. You take a Z-Pack, that's for bacteria, not for virus, and you get better in 5 to 10 days. Well, I got better because of the Z-Pack, right? So there's so many things in there, and it's really our job to kind of say, hey, listen, this appears to be viral, and there is no benefit in giving you a Z-Pack at this point. You will get over this by yourself. And you're right. Unfortunately, society is very much about what can I do right now? And I want to get something, right? I want something. I want to get something that I want to take a pill that makes me skinny right now, right? As opposed to the slow burn is exercise, get good sleep, eat right, you might lose weight. So somebody who comes to me and wants an antibiotic, it's interesting. Before, you could make arguments, but now you really can't. And because of all the antibiotic related illnesses, there's this entity out there called C. diff colitis, where you take an antibiotic first for an infection that you do not have, and it kills the good bacteria in your gut. And then the bad bacteria, which we all have, called C. diff, Clostridium difficile, it overpopulates the colon, and then you get really bad diarrhea.
Wow.
In fact, I have a funny story. When I was in residency, sorry, not when I was in residency. When I was an intern, I had an attending his attending this happened to. So we're talking about maybe 30, 40 years ago. Okay. This guy was a gastroenterologist, which kind of makes it funny, but he's a gastroenterologist. He came in with like probably a viral syndrome, right? He requested IV antibiotics, which he got. I mean, he's a doctor. He's one of the senior doctors. He came in, he wanted antibiotics. He got it, right? He later developed C. diff colitis so bad that they had to cut out a piece of his colon.
Wow.
Yeah. So that's how bad C. diff colitis can get. So if you can kind of approach your patients and say, hey, listen, for us to do antibiotics is really not recommended. I wouldn't give antibiotics to my family member at this point. I know it's tough, but you can get through this. You have what it takes for you to get over this infection. I still think a lot of people won't go for that and they'll get angry, and that is what it is, right? But that's how I would approach it. And I would also say that if this doesn't work, that you can come back, right? Because sometimes you can have a viral infection. Very seldom can you get a super infection with a bacteria, but it can happen. So it's not like the diagnosis is wrong. It is a viral syndrome, but what happened is because of your viral syndrome, 5 or 6 days down the line, because you didn't get better or whatever, that a bacteria at that time super infected you.
Yeah, and I know myself, it's always, I want to get back to work
Yeah.
as soon as possible. I want to feel better as soon as possible. So you think that by taking the pill, it's going to do that?
It can. So if you have a bacterial bronchitis or a bacterial pneumonia, you take Z-Pak. I mean, the numbers are kind of like, these aren't exact numbers, but let's just say it'll take 21 days for you to get over it. If you take the antibiotic, it might take you 10 days to get over it. If it's bacterial. If it's viral, then you're just going to get over it when you get over it.
I see.
But now, in addition to you trying to get over it, you are now introducing all the side effects of the antibiotic.
So it kind of was too much of a shift where it was underdiagnosis and now we're overdiagnosis. But do you think the shift that we've had now is preventing more? Well, I guess it would, right? Like if you're overdiagnosing, I think just inherently you would prevent more mortality.
That's a
right?
really good question. Like you can go too far, right? Like to your point, Trevor. Like if they raise, this is really so stupid, okay? But I'll just say it just to drive the point home. When I was a kid, the age to drive in Canada is 16. Is that what it is here?
Yeah.
Okay. If you increase the age to get your driver's license from 16 to 17, then you will obviously decrease the number of teen-related drunk driving deaths, right? Obviously, because less teenagers, a whole year less, right, are not driving drunk.
Right.
But where do you stop, right? Are you going to make the driving age like 100? Because then no one will be on the road and no one will get into these alcohol-related accidents. So yes, I do think there is a little bit of overdiagnosis, but I think we're good at it. For example, let me give you an example. An old man comes in and they come in with pneumonia, real bad pneumonia. They're 90, okay? And for whatever reason, they check a PSA. That's your prostate specific antigen. Okay. That goes up if you have prostate cancer. All right. Okay. So we diagnose some people with pneumonia, and we diagnose them with prostate cancer, and they're 90. And I only know this because I've talked to so many urologists about it when I was younger. If they have a PSA and it is prostate cancer, they're more likely to pass away from other causes than the prostate cancer itself. So you leave it alone.
I see.
So we are becoming better at that. We also call them, like, for example, if somebody comes into the ER with a belly pain, we get a CAT scan, and the CAT scans have gotten so good that we have what are called incidentallomas, right? So if I have pain here and you find an adrenal incidentaloma here, right? Probably don't need to treat it, right? Especially if it's like less than a centimeter, you know? We're getting better at, or a big one here in the desert is nodules, lung nodules. So I trained back east at Penn State. And if you had nodules, that was a big deal. Like lung nodules, that was a big deal. Now we know, like here, people get coccidiomycosis. It's just like a fungus that's in like the soil. And you can have lymph nodes. Lung nodules. And if those lung nodules are small, you leave it alone. Like you get like if you get a CAT scan on somebody and it doesn't show anything, no clot in their lung, no clot, no pneumonia, no collapsed lung, nothing, but they have a bunch of lung nodules that are very small, then you just monitor them every 6 to 12 months, right? Whereas if they're really big and they're a smoker and they have a family history of lung cancer, those are the ones that you monitor more frequently.
I guess on the overdiagnosing topic, do you recommend people just randomly get CT scans or DEXA scans or just check up on your body every now and then because you may not be aware of something that could be brewing inside, and they say early detection is the best. So it almost seems beneficial that people are more hyper aware of this type of stuff, but then it kind of leads into the overdiagnosis problem. Like
My personal diagnosis, I mean, I personally have gotten a DEXA scan. I've checked my cholesterol. I've gotten an EGD and colon. My personal bias is information is power. Like if I find that I have a high cholesterol, I'm not going to have anxiety about it. I'm going to treat it. Or if I have a high blood pressure, like I had a much higher blood pressure when I was, 30 pounds heavier, right? I didn't worry about it because I knew that if I lost the weight, my blood pressure would get better. But there are some people that get anxiety about that. So I guess what I would recommend, and this is my personal bias, is knowledge is power. Early detection is always better. I do not want to have the debilitating stroke, not be able to speak to my kids. I don't want that. I want to catch it and nip it in the bud.
What about you, Mike? What do you do to stay ahead of everything? How often do you get checked out? Do you get DEXA scans or CT scans or anything for fun?
Not really for fun.
Not for fun, but
I'm
yeah.
not trying to run to the doctor for fun like I'm retired yet. I do. We treat a lot of the senior population, and they're constantly in a doctor's appointment. Mm-hmm. And I think a lot of them do that maybe to have a friend, like companionship,
just
or something to do for the day in between lunch or the casino. And so I'm not there yet. But I did put in place every 6 months, I see my primary doctor. If he has me do labs, I'll go get that done, just to early prevention.
Yeah.
So I'm on the same page as you, Doc, with that, preventing it before it happens. And I always I have insurance, as the employer, or I have our insurance. So what am I paying my monthly insurance for if I'm not using it? So I think if you're paying for insurance, you should bare minimum use your primary doctor just to have that wellness check once a year. I'm doing it every 6 months, which I don't know if 6 months, I can maybe push it back to a year. 6 months might be a little much for myself, but I feel good. I feel good when a doctor like you says, Mike, you're okay. There's nothing wrong. Go back to your life. We'll see you next time around. It just it gives you that peace of mind. I think peace of mind is what people go for, right? I think the people that are getting everything checked, you know, and I've had a heart check before. I was having some chest pain, and at the time, I mean, I was working a lot. My daughter was on the way, so I just had a lot of stress going on. So it checked out perfect, but I did, I had that chest pain. So I'm like you, where if I have chest pain or I have something going on like a sore throat, I'm gonna use the medical field to get that peace of mind.
Well, that was a good episode. I think we can tie it up, end it up there. Just final thoughts on it for you guys. Like, where do you stand on like the overdiagnoses, and how should people approach it if they believe that something's going on that they saw on social media that maybe they could have themselves? Just final thoughts on that.
I'm going to stick with what I've said the whole time. Trust your doctor and go seek medical advice versus seeking it through the internet.
Yeah, and honestly, I think that we should try our best to solve problems with the resources that we have. You'll be surprised what a little bit of exercise, good sleep, good eating can do for you. And like, to all the younger viewers, right? You don't need this crutch to belong. But if you truly have something, we're here for you. We'll treat you, and it's okay. But you don't need it to belong, and we're here to help you. And if by trying conservative things like wellness for yourself, like exercise, sleep, eating right, if that doesn't work for you, then we'll come to we have all the medications in the world. We can use them, but the first thing to do is to trust your doctor and trust in the process of let's try something conservative before we jump to meds or jump to a procedure.
All right, guys, that was an excellent episode. I appreciate your insights on the topic. For any viewers out there, don't forget to like, comment, and subscribe. Stay up to date for new content brought to you daily. And thank you, Mike. Thank you, Doc, for another fantastic episode.
Thank you.
And I'd like to always thank our viewers out there. And Doc, as always, grateful to have you on the show with your knowledge. And I learned a lot today.
Thank you. I always love our talks. And it's almost like a what do you call that kind of message? It's like a service announcement, right? Like, really, don't use, like, to the younger viewers, don't use the internet and social to diagnose yourself. Go to your doctor, find out what they think. And, all doctors are humans. If you go to a doctor and they're not willing to listen, or God forbid, they just want to put you on a medication, which kind of gets back to our mistrust issue, just know that there are doctors out there who will sit and listen to you, listen to your problem. Don't, like, to the younger viewers or to maybe the non-medical viewers, a doctor who gives you a medication right away might seem like a good doctor, but the best doctor, in my opinion, is somebody who takes the time and then still says, hey, listen, let's try something conservative. Be very aware, be wary of the doctor who sees you for 5 minutes and writes you for Ozempic. Okay? Be very wary of those people. I guess that would be my service announcement.
Good. Love it.
Yeah.
All right, guys. We'll see you in the next episode.